Okay.
Thank you, Mr. Chairman. I appreciate it. And Madam Secretary, thank you for being here. Because my colleague, Mr. Menendez, just talked about the 2 midnight rule, I have to say that I share his concern over it. And look, I've spent time with rural hospitals back home, spent time with some of our urban hospitals. They just don't get it. And it penalizes some of our beneficiaries. We've got to come up with a common sense way to address hospital inpatient and observation stays. And you're creating, by promulgation of these rules, you're incentivizing behavior that's actually going to cost us more in the end. So I hope you work with us on that. I want to talk about 3 other things if I could quickly. One is substance abuse, the other is Medicare Advantage, and the final one is the budget, since that's what we're here to talk about. With regard to Medicare Advantage, I have a strong concern about the way in which there is a bias in the current way we're evaluating the program. And a little background on this. Yesterday I sent a letter to CMS, which is copied to you as well. Senator Nelson and I, who's on this committee, co-authored it, and we got 40 of our colleagues to sign up, including 21 members of this committee on a bipartisan basis. And we made the very simple point that Medicare Advantage is working. You know, in Ohio, 38% of seniors are on it. More than 20% of those seniors, by the way, are either dual eligibles or other low-income seniors, so-called special needs cases. And, you know, our satisfaction rate is 85%. So people like this program. It provides them a comprehensive health care program, integrated care, disease management that everybody talks about, and this has been shown to lower costs and improve patient care. So Medicare Advantage is something that's working in my state, and seniors like it. And yet CMS has this way that they're evaluating the various health care programs that has a bias with regard to our Medicare Advantage plans, in part because we do take care of so many dual eligibles and low-income seniors. CMS claimed recently that it has taken steps toward recognizing this problem through a request for information and analysis from MA plans that demonstrate this bias. So I would want to bring this to your attention, but also ask you if you have any thoughts today quickly on what are the agency's plans for releasing the results of that analysis so we can see it, so it's transparent, and for implementing a solution to this problem.
So with regard to, we agree Medicare Advantage is working. We believe that the changes that have been put in over the period of time, as you're reflecting, whether it's the fact that 99% of beneficiaries have access, or that the percentage of 4-star plans has gone up to 67%, or that we've seen an increase in the people. So we agree the program is working. With regard
let me just say, if I could, just for a second, so people understand what you're talking about. If you get a rating that has too few stars, then the plan can go out of business. That happened in Ohio. We had a plan that was serving a lot of low-income seniors that was actually run out of business by this evaluation. So it's very important to get the evaluation right. Sorry.
It is important to get the evaluation right. We appreciate the Congress's support in giving us money to do studies and a piece of work on the question of socioeconomic impact on these measures. We are working through that through our analysis we've been given, and there are 2 places that is focused. One is Medicare Advantage, and the other is readmission. We hope that analysis, but we know we can't wait on that analysis, so we're continuing through CMS's regulatory process to look at the issues you've raised with regard to how does the population you serve impact these ratings.
Okay. With regard to substance abuse, thank you for your willingness to put in the budget a comprehensive look at what is a growing problem in my state and around the country, which is opiate addiction, prescription drugs, less so now, more heroin, which is less expensive and causing a huge problem. Number 1 cause of death in Ohio today is heroin overdoses. It's now surpassed traffic accidents. The comprehensive strategy has to include prevention, it has to include treatment, it has to include a recovery, and including using some new and innovative medical interventions to try to deal with treatment and recovery side. So I thank you for that. As you know, Senator Whitehouse and I have proposed legislation to address these issues in a comprehensive way. We'd like to work with you on that. We'd love your help on that to try to get some more co-sponsors and try to get that to the floor. But I think this is a problem that for too long we've kind of swept under the rug, and it's time to deal with it in a comprehensive way.
Appreciate your leadership and have publicly recognized that leadership as part of our thought that this is a place where there is bipartisan energy to do this, not just with the Congress, but also with governors as well. So look forward to working with you on you outlined the areas. Those are the areas that we have that we believe are the right strategic approach.
Well, and I do think HHS has a unique role to play in terms of best practices and research. Final question is just on the budget. We've got very little time left, but the obvious problem in our budget is health care. And I remember when I left OMB, maybe when you left OMB, you had the same reaction. People said, what's the problem with the budget? Is it, the tax system? Is it, the wars overseas? And honestly, it's healthcare. Healthcare is driving these long-term projections that are simply unsustainable. And so I would say what I've told you before in your nomination hearings and so on, we're looking for help. I mean, Congress is hesitant to take on some of these issues because they're controversial, politically difficult. And I look at your budget again and I think, you've taken healthcare costs over the next 10 years from increasing 105%, so more than a doubling, down to 99%. And you're taking, credit for that. And when I look at the changes, frankly, a lot of them are not sustainable in my view because they are cutting providers more in a way that has not been sustainable in the past. And I think would drive some providers away from providing Medicare coverage because of the way you do it. So my only question is, when are we going to get serious about this? How do we get serious about it? If we don't, obviously we're not going to be able to deal with this historic level of debt we have. And as a percent of the economy, as you know, within the next 10 years, based on the Congressional Budget Office, it goes to levels we haven't seen since World War II.
With regard to the issue, I think we have put out proposals that we believe are a way of dealing with it in specific terms, and whether it's the proposal on Medicare Advantage and how we are implementing certain rules, or some of the other things that your colleagues have raised. And on this side, some of our colleagues raised other concerns with our proposals. So we are raising things that we believe we've put together a balanced approach that does things on the provider side and does things on the other side.
My time has expired, and we've got others who need to talk, but let me just make the obvious point, which is we're still seeing, under your budget, a doubling of healthcare costs. And by the way, driven by a lot of things, but one is Obamacare. Significant increases in healthcare costs to that, about 62% of it based on CBO. So these are issues that we're making them worse, not better, by adding more entitlements. So I hope we'll get serious about addressing them.
I do think it is important, though, to reflect that in terms of Medicare cost growth on a per capita basis, it's been almost nearly flat.
And why do you think that is? Sorry, Mr. Chairman, just give me just one second.
I think that is a number of reasons, and this, though, gets to the point of the out years. We as a nation have a baby boom generation coming through. The numbers of people that are going to be on Medicare, it's going to be larger. And as a nation, we're going to have to make a decision about how we feel about that during the time in which that group of people has to pass through. And I think we're just going to have to make a decision about what are we willing to do and how are we willing to think about that in terms of the choices that we make. And those choices come in the form of those people and the commitments that we've made that I think both sides of the aisle believe that we should make good on.
Let me just,
other changes.
I know I'm out of time. Let me just make the point here. Again, Congressional Budget Office, not Republicans, not me saying this. The main driver of that in Medicare is Medicare Part D, where we allow competition, where we have transparency, where you have insurance companies competing for the business of our seniors. It is not the Obamacare model, which again, if you look at the analysis, Obamacare is responsible for 62% of the growth in federal health care spending. Ages of the population, which you just talked about, aging the population being the reason, 21%. And so we've got to get serious about looking at what's actually working. When Marilyn Tavenner, CMS Administrator, was for this committee, she said the actual costs on Part D are now 40% less than the original estimates. And this analysis by the committee responsible for federal budget shows that Part D is by far the main reason we've seen this reduction in Medicare spending. So my time has expired, but I look forward to continuing the conversation.
Thank you, Senator.
Thank you, Senator Portman.